Hello friends. As doctors, we get a lot of interesting cases in which we have to really work hard to understand as to what has happened to the patient, what is he suffering from, how did it start, and how to proceed to save this patient of this illness. So we have prepared a series of around 100 such interesting cases where we had something to learn from it, and it is very interesting so that we can share that with you people also as to how things happen and how the doctors have to deal with it. So today we are going to discuss a case of denial, the case number 3 of this series. So friends, this is a story of a young man around 28 years of age. He came to my OPD with his parents. His parents told me that this young guy is just sitting at home since around 9-10 months, past 9-10 months, because every day he has fever every evening. He has a lot of weakness. He is not being able to do his daily activities also. He is continuously losing weight, and we are getting no solution from multiple doctors. So I asked them that you have to tell me in detail as to how it started. You show me all the papers, the histories that the previous doctors have taken, the investigations, the tests that those doctors had done, and then we'll proceed further as to what is remaining, what else can be done for this patient. But the relatives told me that those files, most of them have gone in Mediclaim, and they belong to Bihar. So some of the files are in their native village, and there's no way they can bring it immediately. So you just make a new file and start afresh as to what is to be done for this patient. I said that's fine, I can start a new file, but it is easier for me to understand what all people have thought about this case. I can compare the investigations that are being done now to the previous files and records. So it gives an idea as to how the disease is proceeding, what the thing was probably 6 months ago, and how much it has progressed in the 6 months duration. Reluctantly, the patient said that, okay, we'll try to bring the file to you. I said that you can also ask any relative or any friend of yours who lives in your native village to just send it on WhatsApp. So they said that we will try to do that, but you just start your treatment and your diagnosis according to your theory. So I said fine. The patient underwent some blood tests, and because there were some abnormalities, we did a ultrasonography of the abdomen. In the sonogram, we found that he had multiple enlarged lymph nodes in his body, which gave an idea of TB. On further probing, the parents told me that the patient has been receiving anti-TB medications since the last 6 months. And because initially for 2 months they took the TB medication from some doctor, and the patient had no relief, so the TB medications were modified and some new type of medications were given since the last 4 months, but to no avail. The patient had no relief with the medications. So being surprised, the sonography looked like TB, and I myself did a sonography of the neck and the legs, and in the neck region I found that there were in fact some enlarged lymph nodes. So to further assess him, I suggested an excision biopsy in which we remove the lymph node and send it for biopsy in the laboratory. So they were willing for that. We went ahead, we did a small procedure, a small surgery, and we removed the lymph node. When I studied the lymph node on removal, I saw that this doesn't look like a TB lymph node. It looked more like a malignant, that is a cancerous lymph node. Being worried, I spoke to the parents immediately after surgery that I have done my part. We have removed the lymph node for biopsy and sent it. The report should come in 2-3 days, but this doesn't look like TB. It is very suspicious and looks like cancer. So the parents were also worried, but they said that let the report come and then we will decide as to how to proceed. I said fine. 2-3 days later, unfortunately, the patient was diagnosed with lymphoma, which is a type of blood cancer. So I called the parents. I told them that there needs to be some further testing done on the sample, which is known as immunohistochemistry, which tells us what kind of lymphoma the patient is suffering from. We did that, and the patient was suffering from classical Hodgkin's lymphoma. Now this type of lymphomas are very well treated by chemotherapy. They respond well. Most of the patients are cured of the disease. So being a bit relieved, I called the parents that see, the patient indeed has cancer, but this is a cancer which can be treated by medications. So you immediately start the treatment with some good medical oncologist. And that day, friends, these people brought all the previous files that they had probably kept at home and kept hidden from me. And on seeing all those files, I was devastated to know that some other doctor had done all these things 10 months ago. The patient was diagnosed 10 months ago with Hodgkin's lymphoma itself. And because the patient and his parents were not willing to accept the fact that the patient is suffering from cancer, these people thought that at such a young age, if we consider this as cancer, then how will our child live? What will be his life be like? And now there can be nothing else that can be done. So they approached other doctors and kept their files hidden. Now the other doctors, very well in their expertise, thought that this can be TB also, which looks pretty similar to lymphoma. So without the previous records available, these doctors started him on TB treatment. And then once the patient was labeled as a TB patient, the other doctors, subsequent doctors, thought on those lines and modified the medications. But unfortunately, the main diagnosis was remaining hidden because of denial. So friends, I understand that denial is a form of defense mechanism. When we are suffering from some stressful situation or some harsh truth, harsh reality, we tend to deny that truth so that we are not saddened by that fact or we are not exposed to that harsh reality. But in doing that, you are actually harming the patient. The patient could have very well received a good treatment 10 months back. His cancer would have not spreaded in those 10 months, which did right now. Anyway, the patient then started this treatment after I explained to them that whatever the reality is, it is the reality. You have to accept the fact and start the treatment. So ultimately, the patient started having the appropriate treatment which he could have received 10 months back. So friends, I urge you that whatever the disease be, whatever the situation be in your life actually, you have to accept it and try to find solutions moving forward. Thank you.